What's a sign that someone shouldn't ignore uh, in the case of dengue?
Next subsequent 3 days is the critical phase where you have all the complications. For example, the platelet counts drop. A typical sign that should not be ignored is when the fever stops, you start feeling very weak, you get a rash, or you get bleeding from your gums, maybe in the stool, in the urine. That is what is a red flag, and we have to monitor very closely.
Can someone have dengue without fever? At what point should someone test for dengue?
So there are various tests for dengue. So there is the dengue NS1 antigen, there is then dengue IgM antibodies and the IgG antibodies. The earliest and the quickest, test is the NS1.
You've had dengue before. Can you get it again?
Yes, you can. Very rich in sugar is should be avoided actually.
Really?
Yeah.
What is the issue with having like high sugar foods during dengue? So again, malaria is quite can be quite an intense infection,
Yeah.
very hard on the body. Does it cause any long-term weakness, fatigue, and things like that? Chikungunya and dengue have some similar symptoms, of course.
The chikungunya typically is diagnosed with a test called the IgM antibody. Now, the IgM antibody, interestingly, is positive after 5 days.
Papaya extract medicines, which is supposed to help improve platelet count. What's your view on that? Today we have Dr. Roshni Ganguly, a family physician and founder of Aswin's Clinic and Project Setu. She leads several national and international roles in family medicine, including AFPI, Wonka South Asia, and the Royal College of General Practitioners. Based in Bangalore, she is actively involved in her clinical practice, teaching, and rural health work. Welcome, doctor. Welcome to the Orange Club. Monsoon is finally here, and as Indians, we have a very joyous relationship with monsoon. But while we love it, the weather and all the wonderful goodness that it brings with it, it also brings a lot of infection, right? And every year, India sees a huge spike in viral infections at this time: typhoid, dengue, malaria, chikungunya, even cholera, right? And so today's session, we want to talk about some of these viral infections. We talk a lot about COVID, for example, right? But what a lot of people don't know is that these some of these viral infections actually have much higher mortality rate than COVID. So we thought that we'll go deeper into talking about some of these. These are diseases that everyone should be wary of, and so we'll first talk a little bit about dengue, and then we'll go into the others. What is dengue exactly?
So dengue basically it is a viral infection and it is a vector borne disease, meaning there is a vector, which is the mosquito in this case, which picks up the virus from an infected individual and transmits it to the other. So it is a viral infection transmitted through mosquitoes.
Got it. And what are the symptoms of dengue fever versus like the common flu?
Sure. So, dengue fever particularly presents with fever in itself and a lot of headache, eye pain, very, very markedly peculiar in dengue. And along with that, of course, there's body ache, there is muscle ache, and you feel very tired and lethargic. Sometimes it may be accompanied with nausea, vomiting, or abdominal pain, but it depends on how severe the infection is
Okay.
and at what stage of the infection we diagnose it in thereby. Yeah,
It feels like many of these are symptoms that are common with other some of the other viral infections also, right? Like chikungunya also has body
that's right.
ache and things
Yeah.
like that. Like at what point should, there's supposed to be stages of dengue fever, for example, right? Uh, what's a sign that you shouldn't ignore, for example? We'll get into, what should someone do when they have symptoms, but
Yeah.
what's a sign that someone shouldn't ignore uh, in the case of dengue?
So coming to the stages particularly, there are three stages, and initially there is a high fever stage, where the virus is replicating. So you typically have fever of say about 100 to 104 degrees, even as high as that, with a lot of muscle ache and all of that. Now, post day 3, typically the fever stops. But the next subsequent 3 days is the critical phase where you have all the complications. For example, the platelet counts drop, there's a plasma leak. So there are certain, parameters in the blood tests which go up and which indicate that it is going into a more complicated phase of the infection. A typical sign that should not be ignored is when the fever stops, you start feeling very weak, you get a rash, or you get bleeding from your gums, maybe in the stool, in the urine. That is what is a red flag, and we have to monitor very closely with blood tests.
Okay. And platelets, of course, is a thing that doctors monitor when you have dengue, right? Why do platelets drop? I mean, just out of curiosity, what happens that causes these platelets to drop in our body?
So basically, there are two parameters. One is the hematocrit, which is the packed cell volume. So typically, blood is made out of plasma and red blood cells. And we are looking at the isolated red blood cells. We call it hematocrit. So it's like the solution and dilution concentration theory, that when you're dehydrated, typically, the hematocrit, or the solid component of the blood, that would go up and the fluid is drying up. So if that is raised, that is one sign that we need to watch for. And thereby, the clotting tendency of blood is reduced, and thereby platelets are affected. So this particular virus, the Dengue virus, affects the platelets. So when the platelets come down, the clotting mechanism of the blood decreases. So you're more prone to bleeding. And that's how it
Got
happens.
it. So, at what point should someone test for dengue?
Yes, so there are various tests for dengue. So there is the dengue NS1 antigen, there is dengue IgM antibodies, and the IgG antibodies. The earliest and the quickest, test is the NS1, which typically shows up between day 1, like 24 hours, to day 5. It comes positive. Post day 5, you have the dengue IgM, which is positive, which turns positive, both of which signifies acute infection. But after 7 days, and you get the dengue IgE, which doesn't really signify acute, but tells you if you've had a past infection. And that's the antibody which signifies. So suppose even if you don't have fever at all, and you're just checking that you have had dengue in the past, then you will get a dengue IgG positive.
Got it. Got it. Got it. And if you've had, this, you brought up an interesting point. If you've had dengue before, can you get it again?
Yes, you can. The reason being, there are 4 strains of the virus. There is 1 to 4 Dengue virus, the 1 to 4 strain. So if you've got the one strain positive, you're immune to that particular strain. But you can definitely get the other 3 strains as well. And that can be more severe.
Wow.
Hmm.
Okay. And so once you say someone's dengue positive, right? What test do they need to do to monitor their health condition?
Yeah. So first and foremost, we need to do a blood count, which gives us very many parameters, like from the hemoglobin count to the hematocrit, which I was just talking about, the packed cell volume, the platelet count, the total count. So in a viral infection, typically, we see that the total count, that's the WBC count or the white blood cell count, that comes down. The platelet count drops. To what extent, that depends on the stage of the infection or the severity of the infection. And the hematocrit particularly signifies whether there is any plasma leakage, which means that the person is getting dehydrated and is more likely to have a platelet count drop.
Understood. Got it. And so, say someone's now been diagnosed with dengue.
Yes.
What is the treatment procedure for this?
So basically, the treatment is supportive to begin with. So we would give, symptomatic treatment. So we would give paracetamol for fever. We would have to closely monitor the fluid balance of the body by asking them to take water and all sorts of electrolyte-rich fluids so that they are not dehydrated. Plus, if they have any nausea or vomiting, we would treat, with medications. with for the particular symptoms that they are having, if it's an abdominal pain. But at the same time, there are certain symptoms which can tell us that, it's getting from bad to worse. For example, if the patient is having abdominal pain or nausea, vomiting, that means very likely that the liver gets involved and there is an inflammation and the dengue is getting complicated and we need to watch very, very vigilantly.
Okay. I've heard that dengue during pregnancy can lead to complications. Uh, is that true?
Yes. Now, pregnancy is a low immune state, you know. So, anything that decreases immunity makes you more vulnerable to infections. And pregnancy is on top of that list. So, definitely, if you're affected and your platelet counts are going down, and God forbid if there are any other complications cropping up from the pregnancy itself, then it's going to go from bad to worse.
And during this treatment phase, right? Two things. One, is there something that you need to eat, something to make part of your nutrition to ensure that you're recovering better? And then how long does it typically take to recover from dengue?
Sure. So, for any illness, and if we talk about specifically dengue, so we can see that, okay, your counts are affected. So, we have to boost up the immunity, and anything to boost up the immunity would be with vegetables, with fruits, which are rich in vitamin. And the body needs to boost up the immunity also with proteins. So you have a lot of pulses, you have a lot of protein rich food, maybe lean meats and pulses, paneer, these would help. And also taking care of the fluid balance, we must take electrolyte rich fluids, tender coconut water, very rich in potassium. Then you have normal water. You can have your soups, a little light, bland food that helps you to recover easily. And definitely avoid, packed foods, preservative-rich foods, oily, fatty foods to be completely avoided. And even very rich in sugar is should be avoided,
Oh,
actually.
really?
Yeah.
What is the issue with having like high sugar foods during dengue?
So it is difficult to digest, and your system is weak, your liver is affected, so everything has to bypass the liver. So any fatty, oily, sugary food is much harder to digest, and your bile is not secreted well when the liver is affected. So yeah.
And so, now let's say, we've gone through the sort of symptomatic testing, treatment, recovery phase. Uh, how do people reduce their risk of getting dengue infection? It's quite a traumatic experience for most people who get it.
Yeah.
How do you is there any way to reduce your risk of dengue?
Well, prevention is better than cure. So it's transmitted through mosquitoes. And we have to be protecting ourselves from mosquitoes. So whether it's through a mosquito repellent, so if you're going out, children playing outdoors, if you're going out, it's better to use a mosquito repellent cream or a spray and, take protection. Second is if you're indoors, then, at night, etc., you can use a mosquito net. That is the other way you can. And there are certain room sprays and things to prevent mosquito, I mean, from spreading. Also, typically beginning with monsoon that you started with, there would be stagnant water in different places, so those are breeding grounds of mosquitoes. So we have to be wary that we don't let water stagnate in different places. So
Got it.
that's
So, basically keep mosquitoes away during
absolutely.
keep your surroundings clean, use neck
Exactly.
sprays,
Yeah, yeah.
mosquito repellents.
True,
Got it,
true.
got it. No, I think that was very insightful in terms of dengue and talking about that.
Mhm.
Um, switching gears to like malaria. It's the other one, right?
Yeah.
So again, we'll start with just a quick introduction. What exactly is malaria and how does it differ from a common flu?
Yeah. So malaria again is transmitted through mosquitoes, and this time it is a organism called uh, Plasmodium falciparum. That is the organism which is again transmitted through mosquitoes. So it's a vector-borne disease again. Now, the common flu is typically through a different set of viruses, and it's not transmitted through mosquitoes. It's an airborne disease. So, directly from contact, from coughing, sneezing, this is how it would spread. And typically, the symptoms are also the respiratory tract symptoms. Like you would have a cough, a sore throat, you would have fever, you would have a runny nose or a stuffed nose, or symptoms like these. Whereas in malaria or dengue, you wouldn't have. It is more related to fever and body ache and muscle ache. But in coming to malaria, you have a lot of chills and rigors. That means the patient is really shivering because there are these spikes of fever which come every 48 to 72 hours. So, along with that, there can be vomiting, there can be nausea, there can be headache. So, those are the symptoms of malaria.
Wow. And why do patients get these fever spikes?
Yeah, so these parasites, the Plasmodium falciparum, or there are again different types of malaria, they occupy the red blood cells. So when these red blood cells rupture, they burst, they release these toxins, and that is when the spike happens. And this typically happens, say, every 48 to 72 hours.
Wow. Uh,
Mm.
sounds quite morbid, but
Yeah.
and are there any like what is a sign that your malaria infection may be getting serious, and are there any complications that may happen?
Yes, malaria typically can complicate into something called cerebral malaria, where you have convulsions and seizures. You have a lot of headache, lot of nausea, vomiting, and that can be a red flag, and we need to watch out for that. Typically, malaria also causes, low sugars, kidney infections, and kidney failures because of the dehydration and the parasite itself. So these are some of the complications we need to be careful about.
So if someone has fever, chills, maybe some body ache, right? Again, at what point should they test for this?
So, on day 2 or day 3 of fever, as soon as possible, we need to do a peripheral blood smear test. That is the gold standard test. There are some antigen tests which have come out, but they are not so sensitive or specific. But the peripheral blood smears tell you exactly which parasite is growing and what is the intensity. So, it needs to be tested as soon as possible. Though, an interesting fact is in Bangalore, in my about 12, 13 years of practice, I haven't seen a single case of malaria.
Mm.
It is more prevalent in the northeastern sector. But if somebody's traveled and come back, it's very important to ask that history.
Or yeah, I mean, growing up in Calcutta, I know that
Yeah, yeah.
malaria was quite a dominant
Exactly,
thing there. Dengue
exactly.
wasn't as much dominant.
Exactly. That is more predominant in South India, especially in this belt.
Ah,
Yeah.
okay. And so once someone gets tested and let's say they're positive, what is the treatment for malaria?
Yeah, so malaria treatment is a little, different, and it varies from, the different type of parasites. So there's something called the falciparum malaria, which is the most severe one. So there you need this artemisinin combination treatment, which is given. In Plasmodium malaria and ovale, Vivax and ovale, we typically give chloroquine and primaquine. But primaquine again is a medicine where we need to check for a condition called G6PD deficiency. There's an enzyme lacking. And if you give primaquine and the person has that deficiency, that can be fatal for that person. So, but the standard treatment is chloroquine with primaquine. And if it's a mixed infection, so it really depends what kind of malaria it is, then it is again a combination of the artemisinin combination with the primaquine. And if it's a very severe one, then I'm afraid it has to be admitted to hospital and you give IV medication.
And how do they know which strain of malaria it is?
That is through the peripheral blood smear that you're going to do and
Right.
check
So
for
that
it.
detects for malaria and the strain also.
That's right. Yeah.
For and again, malaria is quite can be quite an intense infection,
Absolutely. Yeah.
very hard on the body.
Hmm.
How long does it typically take to recover from malaria, and does it cause any long-term weakness, fatigue, and things like that?
Yeah, so it takes typically about 7 to 10 days to recover. But yeah, in the severe cases, it might last up to 1 or 2 weeks extra. And there is a lot of tiredness, there's a lot of a bad taste in the mouth because the medicines itself causes a lot of nausea feeling that comes in. So in a severe case, it would take about 2 to 3 weeks, while other cases, maybe a week or 10 days.
And any particular thing to take care in your nutrition or diet while recovering from malaria?
See, again, the same principles would be applied, that you need to have a vitamin rich diet. You need to have a lot of proteins, because protein is something that repairs your immunity, because whenever you go through any severe infection, a lot of fluids, adequate rest for the immune system to take charge of your health and help you recover faster. So the principles are pretty much the same.
But when you're really sick, right? You
Mm.
don't have a desire to eat at all, and your protein is a little bit takes a bit of time.
That's right.
It's more effort to eat, more effort to digest.
That's right.
You just want to have something light, if
Mm.
anything at all. So how does this work? You don't feel like eating, then
Mm.
only.
Yeah, we'll have to balance it at some point. So maybe, a soup, a bread, typically in an Indian scenario, a lot of, little bit of khichdi with some stewed vegetables, some little bit of sauteed paneer, fruits in between, have a glass of buttermilk, or have a glass of tender coconut water, or an electrolyte rich, water. So you have to mix and match, and as much as you can take, in the sense we don't need to force feed,
Yeah.
but small, frequent meal patterns would work better with fluids.
Okay.
Yeah.
Okay. Is there a vaccine against malaria?
Not yet.
No. Okay. All right. No, that was very insightful. I think.
Thank you.
Very good to know. I've had malaria when I was like
Yes,
a long
I've
time
had
ago.
it too,
Yeah.
back to back.
Okay. So can you get malaria again?
Yes, you can.
You
It
can.
it again, you can get a different
Different strains.
different strain.
The
Yeah,
same concept
yeah, yeah,
applies. You
yeah.
cannot get the same strain of malaria or dengue, but you can get a
But
different.
in malaria, you might get the same strain as well. In dengue, you don't.
Okay.
Yeah,
All right. Good to know.
yeah, yeah,
Talking about the third one, chikungunya, right?
yeah. The deadly one.
Yeah, chikungunya is supposed to be very deadly and can leave you with joint pain that lasts for weeks or even months, right? So what is it? What are the symptoms of chikungunya? Can you tell us a little bit about that?
So, a chikungunya again is a viral infection, again transmitted through mosquitoes. Now, the interesting part is the chikungunya and the dengue both are transmitted through the same mosquito, that's the Aedes mosquito, but the virus is different. So, it depends which infection the mosquito is picking up from the infected individual and what is it transmitting to you. So it's pretty much similar to dengue. So it comes with fever, it comes with a lot of body ache. But in chikungunya, the joint pain can be really alarming and disabling, rather, because this particular virus, it's the chickpea virus, it deposits or it attacks the outer covering or the synovial fluid of the joints, and that is why that outer covering of joints, it is inflamed and it becomes stiff and very, very tender. And a mild case would recover within, say, 7 to 10 days, but typically this can last up to months. 6 months to 8 months is very common, and it's very, very disabling.
Wow. And so you said, chikungunya and dengue have some similar symptoms. Of course, in chikungunya, the joint pain is quite severe.
That's right.
So at what point do you need to then test for chikungunya versus something else? How do you know?
Yeah.
Once
So
the fever sets in.
sure. The chikungunya typically is diagnosed with a test called the IgM antibody, and there is also a PCR test. Now, the IgM antibody, interestingly, is positive after 5 days. So, initially, if you check for chikungunya, if you maybe suspecting both dengue and chikungunya, then it's good to do the dengue test first and rule that out, and then after day 5. But the clinically, as doctors, when we see the patient and when we see the magnitude of the joint pain, it's pretty much clear. So when it's clear, we start treating and giving all the supportive care and the treatment, and then test it after day 5.
Got it. And what is the treatment in the case of chikungunya?
Again, supportive, fluids, rest, a balanced diet, and as per your symptoms, we give symptomatic treatment. Yeah.
And how long does it take to recover from chikungunya? Like just a symptoms of it, the initial symptoms?
Yeah, so the initial symptoms would last of say about 3 to 5 days of fever and your body pain and your weakness, tiredness, fatigue. But the joint pain is the one which troubles you, which can go into weeks and months. And that is the time sometimes, even analgesics or painkillers do not work. So we can go up to giving steroids because the inflammation is so high that the patient is hardly able to bear the pain. So in that kind of a situation, we have to give a short course of steroids to decrease the pain.
So let's say someone has chikungunya. Now, of course, no one wants joint pain for months post that, right? Is there anything that they can do proactively during the early onset of the disease to reduce their, post disease pain?
I mean, not really to ward off the joint pain completely, if I know, to be honest. But, taking enough rest, taking your anti inflammatory, taking your fluids, uh, and giving your body enough rest and fluids to recover is the best that can be done. But I don't think that's really going to help if the joint pain has to come and if it's a severe variety of chikungunya, then
So it's really a
even
bit of luck, is what you're saying.
absolutely, yeah.
Okay. All right. Not very optimistic, but no, that's very good to know.
Yeah.
In fact, chikungunya just it's just I've heard of generally I've heard of patients when they get it, it's just really hard for them.
It is indeed.
Yeah.
Yeah.
Cool. No, that was very insightful. We have in the next section, we just want to generally talk a little bit about viral infections and things like that. Uh, so why do people fall sick during monsoons? Why do people fall sick more often during monsoons?
Yeah. The reason being, during monsoons, one is the humidity in the air is more. There's fluctuation of temperature, and, there's a lot of water contamination because you would get water stagnating, there's flooding, and, there's a mix up of the sewage and the normal water. So it depends on what kind of conditions you're staying in, number one. And starting with humidity, when there's humidity and more moisture in the air, the viruses kind of hold on more onto the water droplets and the moisture. So it just stays there for a long time. So you're more prone to getting it. That's one. Second, fluctuations in temperatures again, would typically attack your immune system because your immune system is trying to find out that at what temperature it should function. And with that, you become more prone to a cold and cough and fever. And then again, with water flooding and contamination of water, you may get breeding of mosquitoes, so mosquito-borne diseases. You may get waterborne diseases like diarrhea, cholera, typhoid, hepatitis. So, all that is food and waterborne starts coming in with the contamination of water. So these are the common causes, the why people fall sick during monsoon.
So one, of course, I think good advice that you're saying is generally keep your surroundings clean. Right. So
Absolutely. Yeah.
stay away from stagnant water,
Yeah.
it that
Yeah.
reduce that throughout your house.
Yes.
Uh, but what can people do to improve their immunity during the monsoon season to reduce their risk of getting any kind of these dangerous viral infections?
Sure. So one is the prevention part. As for the mosquitoes, etc., which we have spoken about. The other thing is water, preventing the water contamination, which means that you boil your water or use RO water. So again, it depends on from which socioeconomic class you're coming from. So everybody may not have access to RO and water purifiers at home. So in that case, they would have to boil the water. Otherwise, you use clean water for your drinking and cooking and things like that. Apart from that, washing your hands, hand hygiene is very, very vital. Simple food, not very difficult to digest food to consume. When you digest things easily and you function well, it's lighter and better, and you get a lot of energy. Again, rich in vitamins, minerals, adequate water, sleeping on time, that too, because your body gets enough rest and functions well. If you're stressed out, You have more proneness to getting something called a cytokine storm, which is like, huge release of toxins, which happen when you get these fevers. And then when you are stressed, you also release this natural cortisol from your brain, and that weakens your immunity, making you more prone to infections.
Interesting.
Yeah.
So just a regular healthy diet, getting regular sleep.
Yes.
Does exercise have any role to play in your immunity?
Absolutely. If you are doing your regular yoga, your exercise, then your muscle strength is good. And at the same time, when your muscles are functioning well, your circulation in the body, the blood flow in the body is good, which again boosts your immunity and doesn't allow any kind of infection to settle in.
Got it. Got it. And one last question on this from the general infection side. Does fasting have any impact on, your immunity levels or anything to help you speed recovery or anything like that?
Well, I beg to differ, not at all. Because when you're sick, there's no evidence whatsoever that if you're fasting, you'll recover.
Mm.
You'd rather have a balanced diet, you take enough rest. So you have to eat well to recover. You have to have your fluids to recover. Where will you get your energy from? So fasting is a definite no-no.
Okay, good to know that.
Yeah.
Uh, at this time, as parents, right, we worry about children's health a lot because, they're small, they're prone to infection, uh, less careful in that sense, right? Uh, what do you see in like kids, right? What are the common health problems that children face during monsoon season?
Well, pretty much the same things, they are also, and children, again, we have to be very careful with their hygiene because they're playful, they're going out, and hand washing and keeping them clean
Mm.
is very, very vital. And again, the mosquito prevention strategies apply to them as well because when they're going out to play, we'd rather apply the mosquito repellent creams or sprays and be careful and then send them. Indoors as well, it's a good idea to use nets or coils. Even coils indoor would prevent you from getting the mosquito bites, and children particularly, giving them a healthy diet.
Mm.
And in today's world, I
That's the
think
hardest
it's
thing.
yes, yes, indeed, because we're so prone to having junk food, and these preservative rich foods and processed foods are so high in salt and sugar, and it has no nutrition benefits at all. So right from the toddler stage, to build up a healthy eating habit is very, very crucial for parents to look into, to prevent and build up a healthy, strong
Yeah,
child.
wow. Like keeping kids off screens and like letting them eat
Oh
healthy
yes.
foods, I feel like like the hardest things to do in today's world.
Absolutely. I think we perceive it as hard, but if we try as parents, I think it's possible because sometimes, we are so busy in our work, we just want them to be sitting in one place, and it's for our convenience that we give the gadget to them. But when we grew up, our parents didn't have any gadgets, and and we've grown up the way we are, and we made it. So I think it's very vital in the initial growing years itself
Mm.
to have a discipline in these areas, food habits, making them sit in one place and eat. You'd rather have a baby chair instead of, I see most parents or the caretakers would be running about the children in a playground, running after them with food, and the child doesn't even learn the urge to eat, or doesn't even have the urge because there's somebody always following the child and chasing him or her with food. So that bit of understanding and independence to the child, and nurturing the child in such a way that the child understands when he or she is feeling hungry, what is necessary, enjoying the food, knowing what the child is eating, all this is so important.
Mm.
Instead of just putting the child on the chair with a phone or a TV on or an iPad on, and the child is just doesn't even know what he or she is eating. So that's very, very harmful in the long run.
Okay. Yeah,
Yeah.
that's good advice actually.
Hmm. Hmm.
Uh, no, so that covers the part on children. Now the last section that we have is what we call as seen on social media,
Okay.
right? where we hear about some statements, and what we want to do is like a fact check with you.
Sure,
So a few statements where you can respond
sure.
as you feel. So can someone have dengue without fever?
Yes, in mild cases, very rare though. Dengue is always accompanied by fever, but if you have a very mild variety, then you may have a maybe a very light fever, 99-degree Fahrenheit, which sometimes goes unnoticed, and you just feel you have muscle aches, body aches, and headache. So that kind of situation you may.
Got it. And is it safe to exercise or move around while recovering from dengue?
Well, no, we must give our body some time. Not immediately, we cannot go into a very strenuous exercise pattern. No. You have a light walk, you begin with that. Maybe start with some breathing exercises, but definitely not something which is strenuous. You have to give 2 to 3 weeks for the body to recover and then start your regular exercise.
Others. And I've heard this that do dengue mosquitoes bite only during the day?
Yes, that's true. The Aedes aegypti mosquito, that is, they are prone to biting during the morning and the late afternoons.
Why is that?
There's no possible reason. Probably we'll have to look up the reason, but the proneness is mentioned everywhere. Yeah.
Okay. Uh, during dengue, there's a suggestion for some papaya extract medicines,
Hmm.
which supposed
Hmm.
to help improve platelet count. What's your view on that?
So, as a practicing physician, I would say there are two sides of the story. While papaya extract, I don't know the mechanism of action, but I have seen it work to improve platelet counts. But if you talk about proper medical evidence that you know how it increases it or whether it has any effect, no, there is no strong evidence saying that. But practically speaking, I mean, because people do take it, they would get the papaya leaf, churn it into a mixie and just have 1 spoon of it on empty stomach. And doing that, I have seen the platelet counts improve to some extent. So we'll have to take it. It doesn't really do any harm, but we'll have to again be very in a precaution mode while monitoring the patient closely. We shouldn't just have blind faith.
Yeah. So you're saying, I mean, like you said, this treatment is anyway symptomatic. You
Exactly.
make sure you're eating a balanced diet,
That's right.
good hydration,
Yes.
like you said, coconut water,
Yeah.
lots of rest.
Yeah.
And then this, papaya extract medicine may be helpful. But
Yeah.
there's no like research to prove that
Exactly.
or
Yeah.
anecdotally feels it.
Yeah. Yeah. True.
Got it,
Mm.
got it. How's your experience been with Orange Health?
Well, my experience has been fabulous, and one thing which I really like about Orange Health is the punctuality and the immediate response when we, generate a query. If a patient requires it, the callback time is very short, and the way the lab technician or the phlebotomist comes home is also very professional. So these three things I would say is wonderful.
Super. Thank you, doctor. Lovely talking to
Thank you
you.
so much. Thank you for having me.